Good morning, students. Today we are going to discuss more about communicable diseases and their transmission. Earlier, we have discussed that communicable disease is one that is spread from an infected organism to another healthy organism directly or indirectly. The terms infectious and contagious are also used to describe communicable diseases. Communicable diseases are caused by pathogens. A pathogen is an infectious agent or simply a germ that causes or can cause disease and damage to a host. Pathogens are usually microorganisms such as viruses, bacteria, fungus, and protozoa. They may also include parasitic worms. Some bacteria, fungi, viruses, or protozoa are pathogens that cause diseases such as cold, influenza, malaria, chickenpox, measles, and so on. Individuals who are likely to develop a communicable disease after exposure to the infectious agents are called hosts. All a pathogen needs to thrive and survive is a host. The host acts as a biological refuge, providing nourishment to the harboring pathogens, which utilizes host resources to attain sexual maturity and complete its life cycle. Some diseases caused by different pathogens are given in the following table. The following table lists some common communicable diseases, their causes, modes of transmission, effects, and their symptoms. Some common vector-borne diseases with their effects and symptoms are given in this table.
Transmission of communicable diseases through food, water, and insects. The germs of diseases like cholera, typhoid, jaundice, dysentery, etc. are transmitted through contaminated food and water. When the infected people defecate, bathe, or wash clothes near rivers or lakes, the germs from their feces, body, or clothes get mixed with the water. When such contaminated water is used for drinking and cooking, these germs enter the human body, causing diseases. Germs also get into food when it is cooked in dirty utensils or with dirty hands. Thus, disease-causing germs can enter our body through contaminated food and water. One more way of spread of diseases is through insects. Houseflies carry the germs from garbage cans and deposit them on uncovered food and other items. Also, diseases like malaria, dengue, and chikungunya are spread by mosquito bites. Some mosquitoes act as a carrier for disease-causing germs. That means when a mosquito bites a sick person, it sucks blood along with the germs of the disease. And when the same mosquito bites a healthy person, it transmits the germs of the disease into the blood of that person. However, all mosquitoes do not spread these diseases. Dengue is caused by Aedes mosquito, whereas malaria is spread only by the female Anopheles mosquito. The specific symptoms of malaria include fever with chills and rigors. Malaria can also be detected by performing a blood test, which confirms the presence of malaria germs in the blood of the patient. One more way of transmission of communicable diseases is through direct contact. Diseases like common cold, measles, chickenpox, ringworm, etc. spread through direct contact. They spread by sharing clothes, towels, combs, etc., which have been used by a person suffering from these diseases.
Bacteria cause diseases like plague, tuberculosis, meningitis, typhoid, and pneumonia. Viruses cause diseases like common cold, measles, chickenpox, polio, AIDS, and influenza. Protozoa cause diseases like malaria and dysentery. Fungi cause diseases like ringworm, athlete's foot, and food poisoning, spreading through cuts in the skin. If the skin gets injured or cut, bacteria enter through the cuts very fast. Germs causing diseases like anthrax and tetanus enter the body in this way, spreading through carriers. Some people carry the disease germs, but they do not suffer from the disease themselves. They may still pass diseases to other persons. Such persons are called carriers. Cholera, typhoid, diphtheria, and amoebic dysentery may be passed on in this way, spreading through polluted soil. Hookworm eggs and larvae are found in the soil. When a person walks barefoot on such soil, these larvae enter his body through the skin between the toes. Spreading of diseases. Diseases caused by germs are easily passed from a sick person to a healthy person. Such diseases are called communicable diseases. These diseases spread in many ways. Spreading of diseases through infected food and water. Eating or drinking infected food or water brings the germs inside a healthy person's body and cause diseases. Flies play an important part in contaminating our food. Diseases of food canal like typhoid, cholera, tuberculosis, jaundice, dysentery, and food poisoning are transmitted through food and water. Spreading through air. Diseases like influenza, cough, cold, smallpox, chickenpox, measles, etc. pass from one person to another through breathing air containing germs. Precautions taken against communicable diseases. The patient should be isolated from other members of the family and kept in a separate room. All articles used by the patients should be kept separately and properly disinfected. All causes of infectious diseases should be brought to the notice of the health officer for taking necessary precautions. Disease germs remain in the room used by the patient. So, After the patient recovers, the walls, floor and ceiling of the room should be properly disinfected. By preventing the growth and multiplication of germs, rubbish and garbage should be collected in separate bins and always kept covered. Latrines and toilets should always be kept clean and washed with disinfectants like phenyl. Drinking water should be boiled and kept properly stored. The house and its surroundings should always be kept very clean and all drains kept covered. All articles of food should be properly covered and kept away from dust and flies. Pasteurization is a method of killing harmful bacteria in milk by boiling the milk for at least 30 minutes and then chilling it quickly. This is done to kill the germs. By vaccinations and inoculations. By vaccinations and inoculations, we can check the spread of communicable diseases. Whenever there is an epidemic of plague, cholera or typhoid, it is wise to be inoculated against them in order to protect ourselves against these diseases. Immunization protects children against some common but deadly childhood diseases like diphtheria, whooping cough, tetanus, polio, and measles. A child is immunized through vaccines which are either injected or given orally. Spreading of diseases through insect bite. Insects like mosquitoes, fleas, bugs, lice, etc. suck the blood of people when they bite. When they bite a sick person, they suck the blood containing disease germs. These germs are passed on to the next person they bite. In this way, diseases like malaria, plague, etc. spread from one person to another.